Hello and welcome. This is Mohammed Bibaji here on ARTV. We are at the Sharab Medical Center to witness a free medical surgery, an opportunity extended to 40 patients here at the Sharab Medical Center. This is solely sponsored by the Direct Aid and collaboration with the Ministry of Health of the Government of the Gambia. This is an opportunity that has been here since last year. The team, or the medical team, extended this opportunity to 30 patients here in the Gambia, and then this year this number has been increased to 40. And from what I've been able to gather from the organizers, they are looking forward to increasing this number by next year. This surgical opportunity is given to those that patients whose hands are tied and then they cannot offer these fund their operations for themselves. This is an extension that is given to them to facilitate their surgical processes, and here it is done for them at free of charge.
For coming in today. Thank you for trusting Sharab, and this thing wouldn't have been possible without you guys. For the opening remarks, I would like to call on Abdul Baki Tufik to come and give the opening remarks. Mr. Tufik, you're welcome.
Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alamin. Wassalatu wassalamu ala Rasulihi al-Amin wa ala alihi wa sahbihi ajma'in. I would like to use this opportunity to thank all our guests who came to participate with us on this opportunity to opening ceremony of surgical programs which Direct Aid Health every year, once or twice, in according of these programs. Honorable guests, doctors, and our patients who are here to benefit from these programs, I would like to say to you, welcome to Sharab Medical Centers again. Thank you, everybody. Direct Aid, as most of you know, in Gambia works in different sectors. Among that, health is one of the sectors which it is do on it. Sometimes we do eye camp every year once in Gambia and do such a kind medical surgery a year 1 or 2. Within the programs which we do, like caravans and circumcisions and other programs which we do in our centers, in our clinics. As all of you know, Direct Aid is international NGO which is working in Africa, more than 30 countries, doing purposely on helping Africa in education, health, and development, as well as Gambia. So Direct Aid is so happy when it is share and participate the problem of African society to minimize it is. Artist's vision is to minimize or to eliminate disease, poorness, and illiteracy in Africa. We say again, thank you for you coming to participate or to benefit from these programs, as I thank Dr. Ja and his staff for working with us for a long time to do such a kind in a very good way and fruitful, which all the patients who benefit from these programs thanks Sharab and thanks Direct Aid. Representing myself and Direct Aid, I would like to say to you again, thank you everybody. Assalamu alaikum wa rahmatullahi.
I would like to call on our Chief Medical Officer and Lead Surgeon at Sharab Hospital, Dr. Gindelines Dennis Delafair.
Good morning, all of you. I'm very happy to be here. I'm very happy to see you, all of you again in this year, because I would like you to remember that in June of 2021, we had a camp where we did a surgery for 30 patients, 32 surgeries in 30 patients, and everything was fine, successful. Our patients were very happy. So I would like to thank Direct Aid for choosing us again for this task. But I have to tell you that this task is bigger, and this week will be challenging for us because today we are starting the camp for 40 patients. We are planning to help 40 Gambians. So the surgeries that we will be performing here will be hernias, minor surgeries, very important surgeries like vesicovaginal fistulas that will help a lot. They are very, very, very important for us. They produce a very big impact, changing the lifestyles of patients. We'll be doing also breast surgeries and also prostate surgeries. So for me to finish in this small tour regarding what we will be doing this week, I would like to thank again Direct Aid, and I would like to thank especially all the 40 patients choosing to be here because they are the reason for us to be here. Thank you for all your trust that you have put in us for this task. Okay, thank you.
So, like we did last year, we like to call on a few patients just to say a few words of how grateful they are to be part of these lucky patients. So, kon niñ ko waxee rek dañoo bëgg a oo kon few patients yoo xam ne ñu ngi bokk ci liste.
Assalamualaikum. Badi misimol. Bal be konton na. Hartonal konton. Telemu kadi saw nyokunda. Nata jaralo la. Leptano nyinto. Menketa Dr. Jala leptano. Mankenea biringa kibaro moy. Kumata mbadum fane taji jaralo nata wala ensiji bal nata na ma koy ro soto me yalan ko nte fe mu me kala ji yo men ye bulo dun koto yem ma koy mbe tantula mbe jayila ala yesu sima bala ni jata kenya anal je film wala so nyim fana ala ma ala ya ayirwani ala ya asamba nyato ni badi misilmol be ala mbe so jata kenya ani sima ba ani la bankunya.
Mr. Suleiman Mas Mbaye, he's also one of the part of the patients. Mr. Mbaye, you can.
Bismillahirrahmanirrahim. Allahumma salli ala sayyidina Muhammadin wa ala sayyidina Muhammadin wa sallim. Allahumma salli ala sayyidina Muhammadin wa ala sayyidina Muhammadin wa sallim. Allahumma salli wa sallim ala sayyidina wa nabiyina wa maulana Muhammadin wa sallam taslima. Assalamu alaikum wa rahmatullahi wa barakatuhu. Ngeen balal ma ci wax ji maa ngi nuyu kilifa yi fi toog di ko dooree si di director of Sharab tey am mbégte kàddu yi may wax nii nag ñun ñi nga xam ne ñoo feebar te amee suñ feebar xamuñ woon fan la ñuy fajee suñ feebar te feebar bi ñu am kuñ ci ne nangam la ci xaalis di nga toog xalaat ko doo xam foo koy amee doo xam foo koy jëlee man ci suma wàllu bopp dama feebar waaye ci mbaaxi yàlla ba ma demee Kanifing hospital docteur Sanyang moo ma gis mu ooma boole ma docteur Denis ne ma soo demee Sharab ñu ngi fa am medical team bu fa nekk ñun free of charge ma ne alhamdulillahi rabbil alamin yàlla ñëw na loolu ñu koy sante yàlla bu baax ba ma fi ñëwee nag yàlla def ma gis docteur Denis mu check ma wax ma ne ma yow dinañ la mun a toppatoo waaye fekka demoon naa place yu bari naan naa garab yu bari waaye yàlla ak mbaaxam moo ma indi lii may ko sante yàlla ak ñun patient si fi toog yëpp ñu sante ko yàlla ndi patient bu fi nekk ku nekk am nga foo jaar ku nekk am nga foo dem ku nekk naan nga garabi sëriñ naan nga garabi olof naan nga garabi tubaab waaye dara waaye man bi ma amee bépp góor soo demee ba am juróom fukki at mayu la foog nga am ko also su la yàlla dimbalee mun nga koo ñàkk am mooy BPH prostate te loolu soo buggee dem pour opérer ko di nga fay ay junne yu bari yu dem up to 100,000 te wax dëgg yàlla su fekkee ne this Direct Aid ñëw na pour jàppale ñu ngi leen a gërëm bu baax te di leen sant bu baax tey gërëm docteur Dia nit ñu ne gan su ñëwee butam la am di xool man ba ma ñëwee ci lopitaan bi I was so impressed li ko dooree ci sécurité bi they are caring and sharing nurse yi waxee noppi réception bi baax na because dinañ la attend laaj la wax a yow ci njëkk ak teraanga li yaakaar naa ne lii lañ soxla ci suñu réew mi kon docteur Dia ñu ngi laa gërëm yaa sa entire team bi te di leen ñaanal yal na yàlla màggal lopitaan bi dem bi am lopitaan bu gën a mag bi nit ki su defee dara wax ko ñun ñëpp doomi réew mi lañ fii lañ dëkk fii lañ juddoo fii lañ yaroo xamante nañ su fekkee docteur Dia mu ngi def façon yii yeneen medical hospital si war nañoo toppa si docteur Dia ñoom itam ñu def ci so Direct Aid yéen nit ñu leen a ñaanal bu baax ndig li ngeen indi ñun ñu toog fii yëpp ñu ngi doon xalaat fan la ñoo génnee xaalis pour fay waaye ngeen ne doo leen fay dara free of charge la ñu ngi leen a gërëm ci loolu te di leen wax ne thank you very much thank you very much thank you very much yéen journalistes yi tamit ñu ngi leen a gërëm di leen sant lépp lu nëbbu ci réew mi yéen a ko dee feeñal ñu ngi leen a ñaanal yéen it seen taxawaal yàlla yàggal ko fi yàlla defal leen jaama jërë ngeen jëf thank you very much.
nañ yal na yàlla nangu ñaan yi yëpp ñu bokk ko incha allah. So the next speaker that I would like to call is Mr. Antumana Kinte, Information and HR.
Dr. Dia and Sharab team, the representative of NGO Affairs, Mr. Seni Lum, members of the high table, colleague patient from Direct Aid. I'm aware we have at least 2 from Direct Aid, patients, our friends and colleagues from the media. Assalamu alaikum to you all. Today's occasion is another milestone for us at Direct Aid, as we continue to live one of our cardinal principles by supporting the healthcare system of this country through sponsoring such programs. Direct Aid is very much aware that such operations might be very expensive for some patients seated here today. Hence our intervention. We would also like to thank the government of the Gambia through the Ministries of Health and Local Government for creating the conducive and enabling environment for us to contribute our quota to the development and welfare of the people of the Gambia. Of course, without which it will have been difficult for us to be able to do what we are doing. On a final note, we want to thank Sharab team through Dr. Abubakar Dia and team. Of course, not forgetting the lady Jallo Jerry. She's been very, very cooperative, and team. Dr. Dia, thank you very much. This is not the first and this is not the second. Hopefully this won't be the last time. You've been helping us. When I say helping us, you've been very, very reasonable. We all know these operations are very, very expensive. Direct Aid, yes, we are the sponsors. We might not be able to have all the monies that some of the operations may require. But due to collaboration, and Direct Sharab always come to our level and understand that yes, Direct Aid as a charity, we have to definitely be with them to be able to deliver as expected of them. We want to thank you very much for that. We are very much appreciative. We want to further consolidate this by signing an MOU, because this is becoming an annual event. So by doing that, we want to sign an MOU that will make it official that every time, say from October, November, December, we want to organize short camps with you. Today's camp, this goes to show that the more we collaborate, the more beneficiaries we have. Because without your collaboration, the number wouldn't have been 40. Last year we did 30. We could not do 40. This year we are able to do 40. Who knows, next year we'll be able to do, with similar condition, 50 or 60. But all thanks to your collaboration. This camp will treat 40 patients, as has been alluded to, with various patients with various conditions from lumps and bumps. 9 patients, we are told. Hernia, 23 patients. Urology, 8 cases. Immediately after this camp, Direct Aid again has organized another one together with Sharab that will take care of the patients suffering from thyroid, vascular vaginal and fistula, and AV fistula rather. So we definitely want to thank Sharab Clinic for this support. It would have been difficult if we wanted to go in for another negotiation. But with the benevolence of Dr. Jah and team, we were able to do a one in two operations. We have 2 operations in one, because the first batch, that is the one sitting here, there is another batch coming immediately after them. So Direct Aid is very much appreciative of the support given by Dr. Jah and team. To you, the patients, we wish you all the best of luck. We wish you successful surgery, but we have no doubt that you are in capable hands, you are in safe hands. Inshallah, you are not the first, and you will never be the last. Those who have passed before you have their testimonies. And then inshallah, we want next time we come here, one of you here will also be here at the podium to be able to give us his successful story. Thank you all very much for the time.
Babukar Gay, the matron of Sharab Hospital Limited, to give his closing remarks. Mr. Gay. Thank you. Welcome.
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. My sincere gratitude to the media houses, Direct Aid Foundation, and the management and staff of Sharab Hospital Limited. On behalf of our medical director and his medical team, I sincerely thank everybody who came today for this occasion. It is a glorious occasion in the sense that Direct Aid, in collaboration with Sharab, is able yet again to conduct a surgical camp with 40 patients who we will treat their medical condition and give them a better life. So Direct Aid, thank you very much for all the generous contribution you're doing for this country. I will add to that, there are more camps planned for the future. And I was informed that immediately after this one, there is another camp being organized to treat more conditions that are expected. So thank you very much on behalf of our able Dr. Jah, Dr. Dennis and the medical team, and all Sharab employees, from the security, as Mr. Mai mentioned, from the security to the reception to the medical team and the nurses. We are doing a wonderful job, and we want the community to be involved. And to the patients who've been here, we appreciate you coming forward, and we thank you for trusting your health issues with Sharab and the team and the generous donation from Direct Aid Gambia Limited. Thank you very much. Good day, everybody. Have a blessed day. Thank you. Assalamu alaikum.
Wow, so yow tam léegi bokk nga ci patients yi so dañ bëggoon a dégg ci yow loolu mën na wax ci programme bi tey.
waaw maa ngi sant yàlla bu baax te di leen gërëm yéen tamit yéen mu ñëw ci programme bi. waaw programme bi man nag feebar bi ma am nii maa ngi ko am depuis 2001 so struggle naa ci a lot dina naa garab yu bari muy garabi tubaab garabi sëriñ naan naa ci waay dara mënut a lifin waaw so dem naa ci medical hospital yu bari Afrique Med laa mujjee sax day gisee docteur Diagne ak yooyu noonu ma laaj ko ndax lii amul benn garab bu ko mun a dissolve mu ne lii amul garab bu ko dissolve mu ne ko waa soo lan mooy issue bi liñ ko war a toppatoo mu ne ma lii xanaa pour opérer rek so ma jógee fa ma dem Serekunda hospital so bi ma demee foofu Kanifing so ma unfortunately ma tasee docteur Sagnang moom moo ma connect ak docteur Denis so ma ñëw fii that Thursday so bi ma ñëwee nag gaa ñu binda suma tur jël suma blood and everything so si la ma docteur Denis wan ne boo fi mu ne nii di nga mën a bokk ci patient mun nañ laa treat ma santee ko yàlla because lii treatment bi ba ma ko laajee is over $100,000 te 100,000 fi mu ne nii ci jamono ji dafa jafe pour ma am ko waaye maa ngi oo képp koo xam ne kii yow Gambien nga te yàlla def na yow feebar bi am nga ko na nga jegeñ si because am na beneen baaj buy ñëw na nga fexe nga jegeñ si su ko defee ñu treat la free treatment la doo ci fay dalasi lu dul tapaasi taxi bi nga fay sa kër ba fii ba Sharab te fay bi dara doo fay butut doo ko fay because Sharab tamit soo ñëwee noos lu ko dooro si sécurité bi noosi si réception bi ñëpp dañ baax dañ laa teg care di la seet ñu ngi laa neemeeku man keroog bi ñu ma ooyee sax I was so surprise ñu neemeeku ma seet naka laa def ñu ne ma waaye da nga war a ñëw tey pour mun a attend meeting bi tey ma ne alhamdulilah so loolu laa ñëwee nag ci meeting bi.
waaw jërëjëf Mr Mbaye I think lii comme noo ko waxee am na solo te pour nit ñi itam ñoo xam ne amuñ opportunité pour ñu mën a am chance bi so loolu baax na si daal. so comme yow li daal final remarque bi bu dee dañoo gërëm wan advice nga amee spécially si nguur bi ak ñoo xam ne comme xamuñ si lii.
waaw maa ngi wax nguur gi ne façon lopitaan yi ñu bàyyi leen xel nañ leen bàyyi xel ba pare nañ jàppale suñ noosi su ndaw yi dëgg la ay jàmbaar lañ ñu ngi liggéey waaye bagage moo manqué ci lopitaan yi su dëgg ñëwee ba dëgg ñëw bagage moo manqué. nañ ut bagage su bëri def ci lopitaan yi because suñ ne ni da ngaa dem lopitaan nga war a jënd garab ñu ne la demal ci pharmacie nga dem ci seen pharmacie duñ ko am yaa ngaa génn ci biti am ko ci pharmacie man loolu mënoo ko understand lopitaan yi nañ ut garab yu bëri loolu mooy problème ba pare jàppale noos yi bu baax because soo gisee comme places like Sharab seen noos yi place bi is healthy is decent soo ñëwee is decent dëgg la ñoom itamit seen lopitaan yi suñ lopitaan yu mag yi di decent waaye nag nañ jàppale noos yi loolu lay wax government bi nañ jàppale noos yi bu baax ba pare jàppale lopitaan yu ndaw yi nga xam ne soj programme su amee rek suñ fa eegee rek du nekk benn problème jërëjëf.
waaw jërëjëf Mr Mbaye jërëjëf thank you. Following the inauguration of the program here at the Sharab Medical Center for a free medical surgery that is advanced, that opportunity given to 40 patients here, the Direct Aid has advanced an MOU to sign an MOU with Sharab Medical Center to make this an annual event. This is an opportunity that is rendered to Gambians, and then looking at the economic effects of surgery and then how expensive this has been. This opportunity has been embraced by lots of patients and families here who are really glad to have benefited from this opportunity. Reporting from ARTV, I am Mohammed Bibaji.